Hello, my name is Dr. Mahzoon here at United Dental in Redwood City. So we've been getting some questions about dental crowns, and I wanted to have a short discussion to answer any questions that may come up. So a dentist would recommend a dental crown in a case where perhaps the tooth is broken. We would place a crown on that tooth to really help protect that tooth and restore that tooth. One would also recommend a dental crown in the front teeth, let's say, to improve the look of that tooth if the tooth is really stained or broken or over time has a lot of wear on it. And the third reason why a dentist would recommend a dental crown is if the tooth was root canaled in the past, you always want to make sure a crown is placed because that tooth becomes very dry and brittle and can break. So we would definitely recommend a crown also in that case. Dental crowns are different for different types of teeth in that, for example, for the front teeth, we would always want to use a really nice aesthetic porcelain material. In the back molar teeth, sometimes we use porcelain with metal. Sometimes we use a nice zirconia, which is strong enough to withstand the forces of all the biting that are on the back teeth. So different areas would, we would really assess the patient and decide what is best for that patient. Front tooth crowns can look very natural. There's a lot of nice porcelain that is in the market and that we use, and they look very aesthetic and natural. No one can even tell the patients have these crowns in the front teeth. A patient always needs a dental crown after getting a root canal because, as I mentioned earlier, when you get a root canal, the tooth becomes very, very dry and brittle and can break and fracture. So in order to protect that tooth from fracturing, we always have to place a crown on that tooth. And that would really restore the tooth and make sure that you can hold on to that root canal tooth for a very long time. A root canal and a crown can be done in one visit. Most definitely, that's how I usually do my procedures. So it would not only cut down on the appointment time, but also after having a root canal done, you really want to make sure that tooth is covered and sealed so that bacteria doesn't get back in and really jeopardize the health of the root canal that was just done. So by performing the crown and root canal at the same time, that is the best option for the patient. The procedure associated with having a tooth crown done is pretty much there will be some numbing. The tooth is worked on. It's usually shaved down to make room for the porcelain. We scan most of our crowns are scanned in my practice, and that really ensures a very precise fit. And that scan is sent to the lab, and the labs just do a phenomenal job on their work and the type of porcelain that they use. So we have no problems having a nice crown that sits really well and precisely onto the tooth. So kids can also have dental crowns. Their type of crown that we use on children are different than adults, but definitely if the kids have a broken tooth that requires a crown, that can also be done. So it is not painful to have a dental crown placed because there is going to be numbing. So there's no feeling in that tooth. The tooth is worked on while you're numb. You get a temporary crown made right after. You have that temporary crown for usually about 10 to 14 days. And if there's any level of sensitivity from having the work done, usually over the counter, ibuprofen is all we need to tell the patients. So a dental crown usually lasts 10 to 15 years. It can go longer if the patient has really good oral hygiene and they're coming in every 6 months for their checkups. But usually the lifetime of a crown is 10 to 15 years. So tooth pain under a crown is usually caused by decay. Cavity starts under a crown, then definitely that tooth can get sensitive. And that means that the crown has to be replaced. So cavities under a dental crown can be fixed by first removing that crown and then cleaning up the cavity and making a new crown. Dental insurance does cover crowns. Sometimes if it's a cosmetic crown, then no, but if it's a crown that's needed to protect the tooth, then yes, dental insurance does cover them. So if there's any questions, concerns about a dental procedure, one should call the office and come in for consultation, and we can answer any questions then. So I hope I answered all of your questions. Please give us a call to come in and have a consult with me, and we can go over any of your concerns. Thank you.